Hi, everybody. This is Dr. Matthew Cavaiola. Today, I'm very excited to be talking about integrative treatments to live a pain-free life. Let's get started. So a little bit about me before we get started. I'm a licensed naturopathic doctor in both California and Arizona. I'm also a licensed acupuncturist in Arizona as well. I received my doctorate degree from the Southwest College of Naturopathic Medicine 2008 in Tempe, Arizona. I also received a master's degree in acupuncture. And I went to the University of Delaware, where I received a bachelor's degree in biology and also a master's degree in nutrition as well. So let's talk a little bit about pain before we get started. So what is pain? I'm not going to read this entire slide to you, but basically it's a complex experience that combines both physiological things that are happening inside your body, and also there's an emotional tie to those physiological responses as well. Interestingly enough, pain really is a warning mechanism by your body that really is designed to protect the organism that's experiencing it. So an example would be you touch your finger onto a hot burner. It's designed to pull your finger away. Your body does not want to be in pain. So really, pain is a signal to tell your body, hey, this is potentially a dangerous situation, let's withdraw. So it really is designed as a warning mechanism. Pain affects almost 100 million Americans, more than diabetes, heart disease, and cancer all combined. Approximately 1 out of 7 visits to a primary care health provider nowadays is actually for the treatment of musculoskeletal pain or dysfunction. And it costs a lot of money. The total annual incremental cost of healthcare due to pain ranges from anywhere from $560 billion to $635 billion in the United States. And this combines both medical costs of pain care and also the economic costs related to missing work and also disability days. So here's some of the most common painful conditions that typically we see in integrative practices. Arthritis is one of the main ones. Rheumatoid arthritis and osteoarthritis, there's a lot of people who suffer from these types of conditions. Autoimmune conditions, really rampant and on the rise in this country. Things like lupus, fibromyalgia. We see quite a few patients with fibromyalgia as well. Headaches. There's a lot of people out there with headaches, migraines, tension headaches, cluster headaches. People who've suffered traumatic injuries in car accidents, torn rotator cuffs, sprained ankles, whiplash injuries. All these things are related to experiencing some degree of trauma. Repetitive use injuries, things like tennis elbow. I see a fair amount of patients with tennis elbow in my practice, and also carpal tunnel syndrome. It's a painful syndrome of the wrist. Infectious agents like Lyme disease can also cause pain as well. So there's a lot of different things and a lot of agents that can cause pain. The most common areas that I see in my practice that painful areas include the low back, knee, shoulder, the head, and specifically headaches, hip pain, hand and foot pain. Those are the most common areas that we typically see as integrative practitioners. So where does pain come from? I like to describe pain or any disease progression from a 3-step process. Basically, either you're healthy down here, you're inflamed, and then that leads to disease down the line. And really our goal as naturopathic doctors is to try to figure out why people are inflamed to begin with and get them going back the other way towards health. Even down here, when you're diseased or when you have these painful situations, you can always go back towards health depending on how far along the spectrum that you are. I mentioned the word inflammation. What exactly is inflammation? Inflammation is a fire in the body that needs to be put out. And again, as I mentioned earlier, it's a warning sign for your body that something is wrong. And again, it's a normal process that's designed to be protective. And here we have cells in your body, white blood cells called lymphocytes, and other types of chemicals that help to protect us from infections and other types of foreign substances, including bacteria, viruses, yeast, and believe it or not, even food. So of course, we now know that there are strong ties between the food that we eat and also inflammation in the body. So here's our example from earlier. So let's take rheumatoid arthritis. So first, originally we have healthy joints. When we're inflamed, we have inflamed joints. And then down the line here, we have rheumatoid arthritis. Anywhere along here, you can have pain. So where does this pain come from? What do we experience along the way, or what's causing this inflammation to begin with? Things like poor diet. We know that diet definitely contributes to inflammation. Food sensitivities, alcohol use, smoking, overgrowth of pathogens like candida, environmental exposure, heavy metals, things of that nature can all cause chronic pain. I love this quote. It's by Rumi. These pains you feel are messengers. Listen to them. And that's exactly right. We need to be listening to these messages that we feel. I think so often is the case where people go along and they say, well, I'm supposed to feel this pain as I age, right? Not really. Your body is trying to tell you, hey, you are in pain. There's something going on internally, and let's pay attention to this and do something about it. So where does inflammation come from? So believe it or not, most of it starts in the gastrointestinal tract. About 70% of your immune system, your inflammatory system, is actually found in the GI tract. And if the gut lining, that where a lot of this starts, becomes damaged, then this can set up a cascade of inflammatory issues in the body. And this is not necessarily something that develops overnight. This usually takes years to happen. And diet is a big contributor to people's, to where inflammation starts in the body. When I talk about inflammation with my patients, I talk about the 4 big guns. We have gluten over here, refined carbohydrates, sugar, there's Coca-Cola here, sugar, and also high fructose corn syrup. Corn in particular can be another inflammatory food, and also dairy. These are the 4 big ones in my opinion. So if you can avoid these types of foods or food groups, you can really do yourself a service to decrease your pain. So I'd like to talk a little bit about treatment options for pain. Conventionally, there's not a ton that people are doing to help manage or get to the root cause of people's pain. One of the most common drugs that's used nowadays is non-steroidal anti-inflammatory drugs, otherwise known as NSAIDs. Unfortunately, these have the long-term side effects of causing peptic ulcer or other types of gastric bleeding, kidney or liver problems as well. So none of these medications really prevents or delays the progression of osteoarthritis, for example. And there's evidence that actually NSAIDs can actually accelerate joint destruction. Cortisone injections are another favorite for a lot of doctors to help manage pain. And unfortunately, these guys are not that great because while immediately they decrease inflammation in the body, unfortunately, long-term, again, they can cause joint destruction, and really they're not getting to the root cause of the problem. As a last resort, doctors oftentimes recommend surgery. Unfortunately, surgery puts people out for quite some time, and unfortunately, recovery is not always the greatest, especially for things like the low back, where you might actually be out for months and still in pain and refractory to the surgery to begin with. So conventional treatments, they're not that great. What we do integratively, there's a lot of things we can do to help people manage their pain and get them out of pain. One thing that I use in my practice, and I've used for a long time, is acupuncture. Acupuncture has been used for over 3,000 years, and provides great pain relief. It's used for a lot of different conditions. The premise of acupuncture with pain is that it helps to focus on blocking stuck energy, otherwise known as qi, that circulates through our channels or meridians. And what we do here is we insert very, very fine needles. These needles are really, really teeny. A lot of people are scared of acupuncture needles, but actually you could fit 10 acupuncture needles inside one hypodermic needle that's used for blood draws. And pain, according to traditional Chinese medicine, is often a signal that the energy of a particular organ is stuck, or it needs attention, or it needs to be moved. For instance, the gallbladder channel is very interesting. The gallbladder channel runs behind the head, and so often is the case where if there is stuck energy in the gallbladder channel, oftentimes people can develop migraine headaches, especially behind the eye. So migraine headaches oftentimes relate directly to gallbladder dysfunction. Not necessarily that there's something wrong with the gallbladder, but the energy of the gallbladder needs attention. So one thing I really wanted to focus on today is to talk about regenerative medicine. Regenerative medicine is a great, relatively new field of integrative medicine. And we have a couple of different techniques that we use to help people get out of pain and get to the root cause of people's problems. Prolotherapy, P-R-O-L-O therapy, is great. I've used it a lot in my practice. What we do with prolotherapy is we inject 3 substances, most of the time 2. Dextrose, lidocaine, and vitamin B12 sometimes. Sometimes there's other substances that doctors are using. Primarily, we're using dextrose and lidocaine. It's useful for almost every major joint in the body. how does prolotherapy work? Well, we talked a little bit about cortisone injections earlier and how they, again, they're good in the short term for decreasing inflammation, but in the long term, unfortunately, they can cause destruction in the body. Prolotherapy works from an opposite standpoint. So prolotherapy, the dextrose in particular, causes inflammatory cells to go to an area to basically cause regeneration, to cause an inflammatory response. The inflammatory response in and of itself can actually cause the body to repair and regenerate. So prolotherapy is really, really great. And again, it's different than cortisone, which causes destruction. This causes healing and regeneration. So it's often combined with other types of therapies like acupuncture. And depending on the joint and the severity of the pain or the injury, typically 1 to 10 treatments is necessary. So prolotherapy can be really, really, really great. And I've had a lot of great success using this in my practice. Another technique that we use is something called platelet-rich plasma therapy, PRP. This is a cutting-edge injection therapy to, again, help most pain syndromes, and it can be used to repair, regenerate tendons, cartilage, muscles, and bone. It's commonly being used nowadays for athletes to repair injuries with minimal downtime. So they try to use this to avoid surgery, just as any other common folk can as well. So what are platelets? So platelets in particular are, they circulate in the bloodstream, and platelets sometimes collect at the site of damage in the body and temporarily repair tissue. They activate substances like collagen repair and growth factors in the plasma to form a clot and allow the wound or injury to heal. So if you cut your finger, one of the first go-to cells in the body to help repair the area are platelets. So when we inject platelets in an area, it basically helps the body to regenerate and repair the damaged tissue in the area. So that's great. This is a very complex picture. You won't be quizzed on this, don't worry. So basically, essentially, we have a wound here at the top, and down the line, we basically cause that inflammation when we have a wound. And again, that inflammation causes the body to activate things and the body to basically be able to regenerate tissue. I wanted to show you this to be able to say, hey, up here we have an injury, down here we cause inflammation, and down here we have regeneration. That's the concept of PRP. So what's involved in PRP? A small amount of blood is drawn from a patient's arm. The blood's collected in a special tube and then placed in a device called a centrifuge. The centrifuge separates out different components of blood, and it spins for about 15 minutes. This is a centrifuge over here. So at the end, essentially what we have is 3 substances. Over here we have red blood cells. This is a solid portion of blood. Over here we have plasma, the liquid portion of blood. And down here we have this small layer of platelets. So what we do is we combine some of the plasma with the platelets to generate PRP, platelet-rich plasma. So this is the concept of PRP. So once we're done, we inject the PRP substance into the tissue. It's usually numbed with either a topical or injectable form of lidocaine, and the injection itself takes about 5 minutes. From beginning to end, the entire procedure takes about 45 minutes. So you're in and out roughly in under an hour. So PRP can be great. I've had a lot of great success using PRP. What can you expect after regenerative treatment? With prolotherapy, oftentimes what happens is you get a spike in pain, so typically 24 to 48 hours afterwards. But then after that, you have a decrease in pain and healing. This is where the healing response takes place. With PRP, you get a much more gradual up and down, and then kind of a more long-term pain relieving or tissue regeneration response down here. So with prolotherapy, you're typically regenerating within about 1 to 2 weeks. With PRP, 4 to 6 weeks is more common. Here's a couple of case examples. Jane Doe, her name has been protected. Her name has been removed to protect the innocent. She actually injured her low back falling off a swing chair on her front porch. She had quite a few prolotherapy treatments coming to see me. She really was interested in PRP, as prolotherapy was kind of palliative. So we injected her low back, her sciatic region, with PRP substance and had dramatic results. And she's been pain-free for months and months now. This was Bob. This is not Bob. This is Tiger Woods over here. Bob was a golfer with bilateral shoulder pain. He had already had multiple rotator cuff injuries. He had a previous surgery on both shoulders. Prolotherapy, he came to me and asked me, what can you do to help me to stay playing golf? And I said to him, well, I think prolotherapy could be a fix for you. And so he came in almost every other week to get prolotherapy, and it kept him on the golf course. Over time, unfortunately, it kind of wore off just because he continued to repetitively injure the area. So eventually we did PRP with him, which made dramatic results. He was pain-free for, I believe, 3 months. And so he really, really loved PRP and shouted it from the rooftops to all his friends after that, especially on the golf course. This was another golfer, Tom, who had unilateral lateral elbow pain, otherwise known as lateral epicondylitis, from repetitive motion, again, of swinging a golf club. Don't worry, not everybody who plays golf experiences injuries. So Tom he had a series of about 5 prolotherapy injections, which reduced his pain from a 10 out of 10. Was really in bad shape. This was a competitive golfer, and he was really suffering on the course, to 0 out of 10 in 5 treatments. So really, really great case examples, and just showing you how small things like prolotherapy and PRP can go a long way for helping people get out of pain.